Jeez. Hi,
Hi,
Lisa.
can you hear me?
Yes, very good. Sorry. We apologize for that. Today I decided the way I would like to introduce Dr. Santora is as a mom of a 10-year-old and an 8-year-old. Take it away, Dr. Santora.
Thank you. They're in the back doing Valentine's cards right now. 'Tis the season. So you can jump ahead. Thank you everyone for being here. I hope you found a couple minutes of meditation while we were getting our technological glitches scheduled, fixed. Guys, be quiet. See a mom of 10 and 8-year-old on a presentation. Very ready for everyone to return to school in person 5 days a week, obviously, safely. The good news that you see here as our first slide is that we are seeing a significant decline in cases in Marin County. We're on track. We're very, very close to red tier. I'll talk about the tiers in a little bit. We're seeing the significant reductions that we're seeing result in a daily case rate that really is at that borderland of red and purple. And this is where we literally just have to wait until Monday of each week to see when all labs are reported out to see if we're moving into red tier next week. But the good news is that we hit our highest peak, and the second good news is that we've come down more quickly than ever before. And we think that one of the contributors is the availability of testing, which we didn't have in July. It was not easy to access testing. And many of you might have remembered in July, if you did get tested, you would have almost 14 days sometimes of getting your results. So we're in a very different space with availability of testing. And secondly, we saw that when kids return to school and people return to work, that COVID-19 transmission decreased across our county. And that's because the primary driver of COVID-19 transmission continues to be at home with household gatherings, both voluntary, where we have people that are making decisions not to follow public health orders and mix their households indoors. And then we have other residents who don't have the privileges that many of us have and have to live with multiple families in order to afford living in Marin County. So really is a tale of two cities in Marin County and navigating that, that gap of income. I can jump to the next slide. And I'm just very proud of this slide. We talk about people not adhering to guidance, but Marin County has the lowest case rate of all counties in the state. So we have the lowest prevalence. We bounce back and forth between Humboldt, Placer, and San Francisco for low case rates, but this week we landed up on top again, and that means we just have a very low prevalence of COVID-19. There were days in January we had more than 1,000 active cases a day, and now we're decreasing that to around 500 active cases, which means we have a prevalence of COVID-19 in our community less than 1%. So that's very reassuring for us. You can jump to the next slide and also be proud. There's people that don't follow our guidance, but on a whole, we see that Marin County residents are really following public health guidance. It's my daughter right here. She's hiding. So this is our blueprint for a safer economy. We always point this out. Like I said, we're in purple, and this is where you actually can see us faring better than the rest of the state. So where we have a total new cases of less than 20 new cases per day per 100,000. The state's average is more than double that. And we're really proud. We're seeing a significant reduction in our positivity rate, which is what is returning us to that tier 2 or red tier, which is less than 5%. And you can see the percent positivity rate for the state is over 10%. So we're on the right course towards approaching the tier 2 or red. And then what many of you might recall is that we were one of the last counties to stay in orange. So that's our new goal. We had a campaign for, I think, a couple of weeks of staying in orange, and that changed, but that is our goal. And we have a lot more supports to achieve that with vaccination now available in our community as well, so which provides us with both acquired immunity through the vaccine. So our community is acquiring immunity, and then we have natural immunity. We estimate, for example, if we have 10,000 known infections of COVID-19, you multiply that by 5. That's what we estimate is the number of people who have had COVID-19, but were not tested for COVID-19. And so that's around 50,000 of our population. That's around 20% of our population have natural immunity to COVID-19 due to a past history, a past infection with COVID-19. We have not seen reinfection with COVID-19 in Marin County. It is possible. There's case studies of that, but we have not seen any cases of reinfection to date. that would wane after someone's immune system has time from their infection. And that's why we're encouraging all residents who are adults above the age of 18 to get vaccinated for COVID-19, even if they have a history of COVID-19 infection. And jump ahead. Can my school open? So I sent an urgent message to the state because there are two guidance documents that are incongruous. And we have confirmed from the state that absolutely our schools in Marin County that have not been open yet can reopen after 5 days in the red tier. So they're using the example of March in the state guidance. We could use the example of February, because I think we're all hoping to see a February start date. If we are announced on February, I'll get the real dates for you so we can think in real time and all move towards a time we're in red. If we're announced on February 9th, a Tuesday, that we are in red, then our first full day would be on Wednesday the 10th. And they count, it's not school days that they're counting, it's just 5 calendar days. So schools that had not reopened would be able to reopen in Marin County on Monday, the 15th. So that's the earliest that schools could reopen if we stay on track to get to the red tier, which we hope to do. All right, you can jump ahead to the next one. So we've updated our guidance. I can't see it now, well, let me see. I reduced the size of my screen and now I can't see it. That's okay, I'll figure this out. I know all these slides, I present them a lot. So we update our guidance. We are always updating every time we move from tier to tier. We update our guidance to align with best practices with evolving research and also to align with the state guidance. So these shifts from tier to tier allow us to stay up to date and stay in alignment with the state guidance. So we've updated our decision tree where it relates to symptoms. So children who have runny noses or headaches do not need to be excluded and tested for COVID-19. Once their symptoms improve, they can return to school without a COVID-19 test. But we have reinforced the importance of children with sore throat or diarrhea. They should get tested for COVID-19. And that's based on emerging research looking at multiple studies. We call them meta-analyses of seeing how is COVID-19 presenting in the child and pediatric population. And then we also have guidance around quarantine. So we're following state guidance where we're only recommending quarantine for the return from out-of-state travel. And the biggest issue that we hear about is Tahoe, and we know that Nevada is on the other side of that lake. This is where common sense is important. If you are in Nevada and going to restaurants and not following California guidance, then that would be considered out-of-state travel and you would need to quarantine on your return. If you are just somehow crossed a state line while you're skiing in the outdoors and you're not engaging in commercial activities in Nevada, then that would not be considered traveling out of state. So both common sense and trying not to fudge what is the intention of the guidance. The other part is that quarantine, if there's any indoor gatherings, have to be outdoors right now, less than 3 households. So the only Super Bowl parties that should happen is if someone has the luxury of having an outdoor TV and can bring people to be outdoors. It's recommended also that these gatherings are only for no more than 2 hours. And these are strategies to decrease the risk of COVID-19 transmission. So pick the quarters or the halftime that you want to watch when you're choosing, if you choose to gather with other households and stay outdoors. And we'll be issuing a press release on that. Jump ahead. Vaccinate all 58. So this is the current state guidance where you'll see that school staff continue to be prioritized and essential workers due to very severe limitations in vaccine supply in Marin County. We have had to prioritize vaccination for the 75 plus population. As vaccine supply increases, we will re-engage strategies to vaccinate school staff. We were fortunate to have a window when we thought we're more flush with vaccine supply to invite childcare workers and school staff to begin vaccination. We had to close that when we had identified that we have very austere supplies. I described publicly at the end of this week, we'll have less than 100 doses, first doses in the refrigerator. We always adjust and accommodate that, but that's how severe the shortage is. As you hear in the news that there's new openings of vaccine clinics on a statewide response or a federal response, that is going to decrease the county allocation. So when Kaiser partners with the state to stand up the Moscone Center for a vaccination, that will naturally reduce the amount of vaccine that comes to Marin County. So all of these state strategies, which in the long run are very effective and valuable at vaccinating the maximum amount of people with the supply that we have, does have an impact on counties like Marin. We saw that in December when we launched the long-term care pharmacy partnership with CVS and Walgreens. You can jump ahead. But I said all the things I thought I was going to say. So again, we do see our school staff as essential prioritized workers, but we're working on the 75 plus population. And this is just the data. The sad fact behind COVID is it is affecting many lives of residents in Marin County, and most notably that population that's over the age of 75. In that group that we've seen who've been infected with COVID-19, there's more than 15% of our residents who've been infected over the age of 75 have died. And that's why we've had to make, again, looking at mortality in age groups, really make these decisions to prioritize vaccinating this very, very vulnerable group. You can jump ahead.
So, yeah, go ahead.
Go ahead. Do you want to say something?
No, Lisa, I was gonna, when you got to the end of your vaccination slides, there's some questions that have come up, and maybe we could stick them in right now, but here's another.
Perfect. I think there's one or two more. So we are now approaching, we're going to be approaching today of vaccinating 13% of our population and approaching 50%, 50% of the 75 plus population. So that shows the age-based strategy has been very effective. We're now deploying mobile teams to vaccinate the 75 plus population who are unable to get to our point of dispensing clinic and who live in, for example, low-income senior housing. And we're working with another partnership to even stand up another point of dispensing site. I'm super excited. Today was the launch of the Kaiser Permanente vaccine clinic at Terra Linda High School. So really thankful for the partnership we have with schools that will allow them, once they receive more vaccine supply, to have a higher volume of vaccination, again, to achieve our goal of vaccinating all in Marin over the age of 18. You jump ahead. This came up on the conversation. We know that there's some people that are hesitant about the vaccine. These vaccines have been development for, the technology behind these vaccines have been development for over almost 2 decades, actually. When they started working on development of HIV vaccine, which was not successful yet, we're almost there. And this experience with COVID actually might jumpstart the next phase in the deployment of HIV vaccination. That's the technology that they use. So this is not new technologies that have emerged just in the past year. These are studied technologies. The other reason why they're able to move vaccines so quickly is that the manufacturers started producing it before they even got approval from the FDA to produce. So that allowed us, literally, we began receiving vaccine 1 week after the FDA approved the Pfizer vaccine, because they were on trucks ready to deploy and go over the 80 pass into California from their manufacturing space. I think it was in Michigan. And then these particular vaccines are just easier to produce and faster to produce than even the flu vaccine. So that's another reason why they were able to bring so quickly. Because, you know, some people are concerned about the vaccine because they're like, it's just too fast. And I don't want to be, like what we hear honestly is people saying they're concerned about being a guinea pig. We'll be working with our community advisory board to do outreach and education to hear and listen to some members of our community's concern about vaccine, and to address the fears and concerns and provide them with information so they can make the best decision for themselves and their families around vaccination. And what we've seen, especially in our long-term care facilities, is after that first, it's like early adoption. After the early adopters have been vaccinated and staff have seen that they're fine and they're safe, that then they are ready to become vaccinated themselves. So we're committed to vaccinating all in Marin. We know affluent white residents will uptake this vaccine very quickly. And our commitment from an equity perspective is to provide more supports and resources to low-income communities of color across our county in order to ensure that they understand the value of the vaccine, that they can make an informed choice about whether or not they want to get vaccine because they have sufficient information, and then that we ensure access to our vaccine clinics. And there is a technology divide in low-income communities, and so we know right now our sole path of getting people vaccinated is signing on a website, and we're developing solutions to make sure that people that don't have access to the internet and have may have language or English proficiency gaps, that will have access to culturally competent bilingual scheduling for these populations. So jump ahead. All right, I'll pause.
Okay, great. Thanks, Lisa. Why aren't you waiting to recommend that schools open until all school staff is vaccinated? In Roseville, 18 teachers contracted COVID when the high school opened up.
We are not seeing data to suggest that we should not open up schools before vaccine. We're seeing data to the contrary. We only have 9 suspected cases of COVID-19 transmission in Marin County. We have been very aggressive. Roseville is a very different community than Marin County. We've been very aggressive and implemented conservative measures in creating and implementing those school site specific protection plans. And so it's been safe, as safe as possible. I mean, many of you may have seen this presentation. There is no zero risk option for us, but we have created the lowest risk possible for the reentry of students into schools. And honestly, the harm that children and adolescents are experiencing by not being in schools is becoming greater. And that's then the risk of COVID-19 transmission itself. The other thing is there's so much we have in control. If you have close contact, it's not a household close contact, but if you have close contact with someone who has COVID-19, and that means you spent more than 15 minutes with them and less than 6 feet, you only have a 5% chance of contracting COVID-19 with close contact. Every mitigation strategy we have is to minimize the amount of close contact that happens in the school environment. And then we also, that doesn't consider the other things that are other preventive strategies like face coverings, as well as hand washing and respiratory etiquette. All of these things have demonstrated to a very low risk of COVID-19 transmission in the school environment. What we're seeing, and I think this holiday showed us more than anything, it's when people are at home and gathering, and that is what drives up transmission. So being in stabilized environments in the school that are structured and supervised is a safer place for many people than their own household, where there's family members that have different COVID beliefs within a family and different fear around COVID, and make decisions around inviting other households into their house where there is COVID-19 transmission. So we agree that vaccination is not a prerequisite for the return of schools.
Lisa, do you see the day when vaccinations will be required, number one? And then can you talk a little bit about what symptoms and what percentage of people you can anticipating having symptoms after their second dose?
We see around 5%, less than 5% of having more severe symptoms. So after that second dose, so like a fever of 104 or 5, but we do have it's a pretty high number where I think it's over 50% of people will have soreness of the arms and chills and body aches after that second dose. That means you got the first dose, and that means the second dose is working. It's building up your immune response capability. So if you were to have any contact with a person infected with COVID-19, it dramatically minimizes your risk of contracting COVID-19. I received the second shot myself last night, and it wasn't the best night. I didn't have any fevers. I had chills for a couple of hours, and I'm hoping for a good night's sleep tonight. But again, what we've seen, especially over the age of 40, which I am myself, is that there's a higher possibility of having a more moderate case of COVID-19, and the benefits, the risks of some of those side effects, again, outweigh the benefits that protection against COVID-19 provides. But again, this is where it's everyone's individual decisions. Informed consent is part of the vaccination process. So everyone agreeing to be vaccinated is stating that they've been informed and understand. And then to your second question about requirements, employers can require vaccinations. We, at this time in Marin County, are not, there's no communication at the state level or at the county level around requiring vaccinations. We do have a mandatory vaccination for flu. We had one in place before COVID ever came here, but there are no conversations right now around mandatory vaccinations. But and I think a lot will depend on what we learn. Again, the challenge with COVID-19 is it's a novel virus, so it's new to us. It's not like we know the devil of flu. We know what our flu seasons normally look like, and we can manage policies to address the risk of flu. We don't know whether people will need a booster shot against COVID-19 or the 2-dose and done, and it becomes like the SARS of 2002. If some of you are old enough to remember SARS, which was also a coronavirus that had an outbreak in 2002 that went away after a year and a half, or actually 2 years without a vaccine. So a lot of this is just ongoing studies as we have a vaccinated population and continue to study. What we hope to see will just be sporadic cases of COVID-19 in the summer going into the fall.
Will the decision tree change for the new category of people who have been vaccinated?
Not yet. The CDC is conservative, and we are conservative as well in our approach. And I think we're going to need to have at least 3 months of information under our belts about how COVID-19 is behaving as what we call herd immunity is increasing in the community. I do see a change, specifically the frequency of testing that's recommended, as well as other things around face covering in the fall. So I do see those things will change, but I think it will only be in consideration after we achieve probably like a 60 to 70% herd immunity level. That's both acquired and natural immunity to COVID-19. And I'm looking at data as it's emerged. So it's really to be determined, but I don't see major changes happening 3 months. Probably until April or May around the testing frequency and exclusion of people based on symptoms. And that will be also a challenge. Your nurses every year are hard at work managing and understanding the vaccination rates among other diseases. And so to try and have an individualized approach on who's vaccinated or not vaccinated will be challenging. And again, children are not, I know there's people stating that children are potentially going to be vaccinated in the summer to fall, but we do not have information. So we're not having a student population that's vaccinated at the start of the school year next year.
Lisa, this is an issue that continues to bubble up, and I know you have addressed it multiple times, but if I could ask you to do it one more time for this group. It relates to the fact that there were additional vaccinations available on the 17th when we did the first round. And this person, an anonymous attendee, is asking, how did administrators get invited to be vaccinated ahead of staff with kids? I understand they were invited to come by Dr. Willis.
So what happened on that day, why we had this event on Sunday, the 17th, was we call it a full-scale exercise. Prior to the 17th, we were only providing 200 vaccines a day at our point of dispensing site. And we wanted to prepare for a major increase in vaccine supply and distribution. And what we do in public health preparedness is we have a full-scale exercise where we invite a group of individuals to go through and get actually vaccinated so we can test our systems. On the 17th, because Kaiser was also going to be launching at Terra Linda, we recognized it was an opportunity for 2 entities to come together, both Kaiser and Marin Health, to see best practices and to partner with each other. Many of you probably received it. Kaiser has tremendous experience vaccinating. They ran a very successful flu clinic vaccination where the last time I heard, it was over 50% of their members in Marin County were vaccinated against flu in a very short period of time. And what happened on that day, as with any exercise, there were 2 different approaches towards drawing up vaccine. We were doing a one by one vial dose drawing up of the vaccine dosage, which slows down the process. And Kaiser taught us something good. They actually do a production of all the syringes behind the scenes and having all those syringes ready to go. There was more vaccine drawn up due to a miscommunication. So we had extra doses. And our primary guiding principle is not to waste doses. It was an end of the day finding where we found out we had 200 doses and we needed to make a rapid call to get the maximum number of people in to get those 200 doses so we don't waste those 200 doses. We learned a lot from that. That hasn't happened, but is not uncommon at the end of any given operation that we can have 10 to 20 doses, and then we're working off of a list. The list that was most available to us at that time was the list that the schools have been developing around having rosters for staff to come and get vaccinated. So we made a decision at that point, once we knew we were going to have extra supply, to have a first come first serve offering of vaccine. That's how that happened, and we appreciate that it doesn't achieve what might be seen as parity, but it was the operational complexity that we were managing during this full scale exercise. So that's why it wasn't, and from my perspective, it wasn't a failure that an administrator was vaccinated before a teacher. What would have been a greater failure if vaccine was wasted. And at the end of the day, you're literally running against the clock where the vaccine can only last, once it's drawn, can only last for a couple hours. So we did our best. And that's a challenge. We've learned from it, and we have been refining, and I can still tell you it's not perfect, refining those end of the day doses when the math doesn't work out perfectly. But the positive is that we have another 200 people were vaccinated in our school community. And so that's a good thing.
Okay, Lisa, how about we'll go back to your presentation?
So this is just, we're going to be updating our dashboard. We listen to the community when they're requesting more information to be publicly shared. So we're going to be updating our dashboard hopefully this Friday. It might not be this Friday. This is a mock-up, but this will have information not only on the number of cases, but also how we're seeing the transmission patterns. For example, we have not had any student to adult transmission. And that's what is new on the right column. And we're also trying to provide a more accurate description of how many students are actually in person. And then I'm going to pause, and maybe this is where you can say MCOE is also working on providing more information about individual level schools and how they are in person, because there is tremendous variability across the county. You want to jump in here, Mary Jane?
No, just to let people know that we are collecting data from all the schools in the county related to how many days a student actually is walking through the door for those that are open, and then how much time they're getting in school, and providing data about how much they are in school each week. And so that will help us understand like how often kids are in school, and then how much time they're actually getting direct instruction in person. So that data is in a draft form now, and people are looking at it to see if it's accurate. We're hoping to have it posted either probably early next week, but that'll be another source of data for the community. And this chart, Lisa, do you want to go through this?
You can go through this one.
Okay, so this is the information that provides us with kind of where we are right now. So it goes back to September 8th, and that was the first date that for this new school year that people were able to begin school, just as a reminder. However, there were programs in special ed, alternative ed, that were operating pilots in May, and summer school programs, but that data is not included here. So you can see the number of in-person days, the number of student days, the average number of students per week, percent of kids that are in person, the new data here of the percent of staff who are supporting site-based instruction that are in person, and then our information related to COVID positive students, staff, and then suspected in-school transmission. So we'll continue to keep that up to date. Reminder, this data is updated Fridays around somewhere between 12 and 1:30 or 2 is the approximate time. And you can see here that in of our Marin schools, 116 public, private, independent, parochial. You can see here that we have just one elementary school that's not yet open for in-person opportunity, one K-8, one middle school, and 12 of our high schools. Just to note that when I look at that list, these are schools, as Lisa described, the issue of the tier and when we could open, that these are schools, I think mostly that are ready to go. And they were actually ready to go the first week of January, but because we were in the purple tier, we're unable to. And so given the data that Dr. Santora provided, assuming next Tuesday we move to the red tier, and then we stay in the red tier for the 5 days, then we would be able to open on the 14th. For public schools, and most public schools, that happens to be the winter recess. And so likely then the first date might be the 22nd of February, which would be the Monday, depending on the school calendar. But that will all be information that we'll find out not until next Tuesday.
Perfect. And the only thing, sorry, I'm losing power. My computer needs to be replaced, and I'm too busy to have it replaced. So the battery dies fast. So I'm going to charge that. The thing I'm most proud of and so thankful for all of you on this call is we're approaching 1 million student days. And that means on average, our kids in Marin County, teens, I'm going to plug now before I'm going to die. Sorry, don't want to die in this moment. We're approaching 1 million student days. And that means on average, our students in Marin County have had 50 days of school in person. And there's so many communities across the state, across the nation, where students have not had the opportunity to be in school. So as a mom, as a health officer, I'm so thankful to all of you. Those 50 days mean so much. I know you carry a lot on your shoulders to maintain safety and to create the best learning environment under these stressors. And I think it's just something for all of us to be proud of this work together, because 50 days is a lot in the lives of our kids, especially our most vulnerable kids. So just the deepest gratitude, and really excited to be hopefully hitting 1 million in a week or two. So you can jump ahead. So this is just research updates. There was a flurry of activity. We've heard this a lot. Marin was on the cutting edge in the beginning of reopening schools, following more clinical trials and research as we were learning about COVID-19 to guide the development of our guidance. And that being said, it takes time to publish research and to get enough data on research. But if you've been following the news, which does provide a lot of this information, there was a flurry of publications from across the nation and across the globe around that have demonstrated the effectiveness of mitigation strategies and demonstrating that schools are not drivers of transmission. So it was an experience. What we're seeing is the global and national research being published now is consistent with our local experience of schools not being a driver of COVID-19 transmission, and the effectiveness of those personal protective measures that we have in place, from starting with educating families to help families make the best decisions that they can, to screening kids at home and following our decision trees for excluding children and staff if they have been exposed or symptomatic, all the way to, again, creating the safest possible environment in the school. So this is just a publication. These are publications that we will share and post so you can have access to it. And we also have updated our bibliography with all of this research that will be posted to our website. So you'll see that how we're both data driven and strive to have an evidence base for the decisions that we have as we move forward. Jump ahead. So stable groups, this will be a change. We had a lot of conversation around cohorts in the beginning, and really conceiving of these very, very small cohorts that we were using to manage COVID-19 transmission. And we're seeing a shift in the language from the state, as well as you're seeing it locally, that we're looking to have stable groups. We're demonstrating that we do not have significant levels of school-based transmission, and that the harm of closing classrooms that have been practicing protective measures outweighs the benefits of preventing transmission. So we will be looking at how new policies, and that will potentially launch as early as when we do go into the red tier, around suspending classroom closures for 3rd grade and above, and then relying on our contact tracing and case investigation methodology to determine which students or staff should be excluded from school, and to have those be limited to those who are identified as having high risk contact, which would be close contact with more than 6 feet, less than 6 feet, more than 15 minutes. I think I know that by now. And so this is also, again, where we're moving. Our guidance does support the return of full-time in-person instruction as long as we have rosters and attendance records. And so that's where we depend on our school public health liaisons, who are another amazing group that we work with, who provide us information around attendance, so we can ensure that we're contacting all the right individuals that may have had a possible exposure. Although even in the classroom, there shouldn't be true exposures because of the efforts are in place to maximize physical distancing and wear face covering. And we also have a new tool called Spot. It's a state portal for tracking cases. And so we are implementing that now, so we can continue to have, we have additional supports to allow us to shift away from a classroom-based closure. The reason why for this time, we're gonna continue to close classrooms that are TK through second, as well as special education, is just because some of the behaviors in those classrooms, there's less self-management that students are able to demonstrate, and there might be a need for just their closer contact at more times to help manage students and navigate students in those grades and in special education. So we are going to be more conservative there, even though with the state guidance, it allows, again, just more specific contact tracing approach. We're going to stay conservative with those grade levels and with special education moving forward. But I'm not anticipating announcing that until we move to the red tier. So you can jump forward. So this, again, just is our alignment with the state California Safe Schools for All. We're really proud that we didn't have to make significant adjustments because they drew from the guidance that Marin County has developed. So we are aligned with the state. This is where I can't see the screen, Mary Jane. Oh, this is, sorry, my screen is super small. There's two things here around testing. Right now, we're recommending a cadence of monthly surveillance testing for staff, not testing for students at this time, except if it's based on exposure or symptom or exposure-based testing for students. We're going to be following this closely. There may be schools that receive additional funding from the state to have an increased cadence for testing, and that would be a school-based decision or district-based decision for an enhanced testing cadence. We're also currently reviewing, this is one area that there was a discrepancy between the state guidance around quarantine. In the school guidance document from the state, they recommend a 10-day quarantine. This is not synchronous with the Centers for Disease Control, which allowed counties like Marin County that has access to testing to allow students and staff to return to school after completing a molecular test or a PCR test, you might have heard that term, 5 days after a known exposure in order to support the return. So right now we're analyzing that, and that might be updated when we update our next tier. So you can jump ahead. Mutations, I know everyone's been reading about mutations. We study mutations in Marin County. We send samples both from our sanitation system. You might not know this, but your sanitation system is being tested for COVID-19. So it provides us a sentinel indicator whether there's increased COVID-19 activity based on your sanitary system. And then we also send a collection of our specimens to the state, our respiratory specimens to the state for analysis and sequencing. And that provides the state with a body of evidence around variants that are circulating in the county. We have sent specifically certain specimens when we saw, for example, a rapid or fast outbreak in a nursing home. And we have not found yet in Marin County any of the specimens we've specifically sent due to concern reflect one of the variants of concern. This is not uncommon. This is what genetic viruses do. They mutate. And so the same protective measures that protect us from one variant protect us from another variant. And it's really right now just a matter of being more vigilant and maintaining that vigilance as we again work together towards achieving that mostly, hopefully more acquired immunity by more of us getting vaccinated than seeing people with natural infections really leading to immunity. So it is closely followed. It's studied at the state. We haven't seen evidence that there's based transmission due to variant activity or variant of concern activity. We closely monitor it, and we're always ready to adapt and adjust our guidance if we see, for example, an increase of outbreaks in the schools due to a possible variant. We have resources available to us to determine if it was due to a variant, and also resources at our disposal to determine if it needs to adjust our guidance around reopening. Jump ahead. So our next update, we try to be as communicative as possible with the entire Marin County community. We're on a rhythm of monthly community updates with the community at large. We call these our monthly after school specials. We have weekly trainings with our public health liaisons, and it's all from the beginning. We've intended to be children focused or student focused, data driven, evidence-based, and transparent with all of the information we have gathered in our emergency response to COVID-19. So these are the forums that allow us to be present and to field some of those questions. And you can always, we also have our, I think I have the next slide, you can jump ahead. Our websites, here you go, are updated regularly. Both the Marin County Office of Education websites are updated. Our website is updated. And then we have our COVID-19 schools email. So, and the state is also now bringing additional resources. I should have added that. The state has its own email and call center if you have additional questions that you're not feeling that we're answering at the local level. But our goal is that you're getting your questions answered at the local level.
Lisa, would you talk a little bit about the data that you've collected locally that you're providing sort of at the national level related to the research, or do you have those slides?
I don't have those slides to share yet, but we have an amazing epidemiology team who, again, we were at the cutting edge of reopening schools across the nation. We've been sharing our experiences with national partners to inform both the policy and other schools on best practices on how to reopen. And we've been working with our epidemiology team and the schools to analyze our own data and to submit that to the Centers for Disease Control. They have a weekly report that nerds like me read. It's called the Morbidity and Mortality Weekly Report. And we're planning to submit a manuscript that shows all the data that you've seen on this presentation, where we believe that after September 8th is when we saw a significant decrease in COVID-19 activity, which provided evidence that schools are a stabilizing factor. With schools reopening, schools are a stabilizing factor. We saw that surge when students were out of school and there was no potential for school-based transmission because they were all out on vacation, and that's when we saw our highest high. And just the documentation we've had with our actual school-based transmissions and documenting again that we have not had evidence of student to adult transmission. The other question I get is this just based on self-report? And it's not. All laboratories in, regardless whether you've gotten a test kit by mail or if you've been tested at one of our testing sites or one of our partner testing sites, are required to report both positive and negative results to Marin County Public Health. We have a team now over 100 contact tracers who call every single person who has tested positive and complete a contact tracing interview. We have 2 priority groups that relate to schools. We identify all individuals who are under the age of 18, and they are prioritized to be called first. And then we have a priority question of when we screen is if they work in a long-term care facility or if they work in a school environment, and that allows our team to prioritize our school-based investigation. So we're not relying on people reporting they've had a positive test. There may be a delay because with technology, a lot of parents and staff get the results of their tests faster than public health does, which is why in our guidebook, we advise everyone to report positive tests or report possible exposures to the school so we can cut it off at the pass. But we're not relying on self-report. We receive every test result of Marin County residents.
Lisa, I'm going to go to some of these questions real quick. Could you describe one more time what % of 75-year-olds in the county have already been vaccinated?
More than 50%, 50.
Okay, great. And do you have a sense, you know that the goal that I've been framing is that all of our educators in all 4 tiers all have their first and second dose completed before the April break. Do you believe that by the end of February, we'll be able to start again with first doses of educators?
Our goal is yes, but we are limited by vaccine supply. Educators and childcare providers are prioritized essential workers in our vaccination distribution. But again, that vaccine supply is our rate limiting step. And that's where we have to balance our policy decisions based on mortality and where the biggest impact of limited vaccination will be. And so we also have to align with the state. And if you follow the news, probably more than I do, because I really don't look at the news, there's been a lot of changes at the state level around vaccine distribution. Most recently from advocacy from the disability community, it's reprioritizing individuals with medical conditions. And that's one place where we prioritize, and we've led the state in prioritizing educators and school staff in vaccination, but sometimes there are factors beyond our control at a state level that can dictate policy. But we're always in communication with MCOE and the school districts. But at this time, it's unchanged. School staff and childcare workers are prioritized essential worker population for vaccination in Marin County.
Mm-hmm. Okay, so there's several questions that, and I'll just take pieces of them and sort of put them together. Same thing. Why, if you're limiting 3 different households from gathering, how can you possibly think it's appropriate to put teachers and school staff at risk when we're supporting students from myriad of different cohorts up to 18 to 24 students? That's one. And then the next one is, I'm thoroughly confused. Are you saying that my high school opens, it will be full classes, not hybrid?
So the first one is because we are not seeing school-based transmission. We're seeing the strategies of wearing face covers, of adequate testing of staff. We're seeing it creating a safer environment. Where we see transmissions is in a household where people are eating and drinking and not maintaining physical distancing. That's where we're seeing this disease spread. Less than 0.9% of all cases in Marin County are from suspected school-based transmission. The lion's share, again, is from the household. What you've done successfully is to create very structured, safer environments where, and I just picked up my kids. Today was the 2 days a week my kids get to go to school in person. And that's where I appreciate the work everyone's doing. It is a very structured drop off, pick up. Students know to stay 6 feet apart. They know to wear their masks. They want to be in school. And I see only from students their commitment to practicing behaviors and sometimes even reporting on their parents' behaviors that the parents didn't want them reporting on, but to keep them in school. And so we've demonstrated that we can safely do it. We have the majority of our private schools back. We are always ready to adjust if we are seeing, due to let's say a higher classroom size, that there are more outbreaks that become of concern. We're ready to adjust, but we believe that and confident right now in the data showing us that we can create safer environments. And then the second question was?
The second question, sorry, I started moving off of that. It had to do with high school. And are you essentially saying that the high school, when it opens, will go back full classes instead of hybrid?
That's up to the individual district and the individual school. So we set guidance. So there are schools already that are open for full-time in-person instruction at regular class levels in Marin County. And really excited when the Office of Education is able to share that publicly to see that this data does include schools that have been open for full in-person instruction, but it's up to the schools. So it's up to the individual school districts with their negotiations with labor and their school community on how they return.
Mm-hmm. Can you talk again about 4 feet versus 6 feet and the new guidance from the state?
So the new guidance from the state aligns with ours that says that 4 feet is permissible. The prevalence that I described of COVID-19 in Marin County, which is less than 1%, is a low risk environment. I know the news amplifies, but if you can see where we are as a county compared to the rest of the state and the nation, we have effectively a low prevalence of disease. So the likelihood of there even being a COVID positive person in the classroom setting is very low. And we find that with research that once you are more than 1 meter away, the risk drops from less than 1% to near 0%, even if there is an exposure even if there's a COVID positive person in that space. So it's guided by data and evidence that shows that even though 6 feet in general, when we're meeting, et cetera, in general is the standard, when students are in a classroom, their desks can be 4 feet apart facing forward. And so that's, again, we would, if there was to be a positive student in a classroom or positive staff in the classroom, we would identify if there are any of those students that happen to be sitting near. That's what we do with our other diseases like measles and measles most specifically, and tuberculosis. And that's why. So the research shows that with the prevalence that we have, then also with 1 meter distancing, the risk of infection from a COVID positive person is approaching 0%.
Can you address the issues of the number of staff that live in a community, a county outside of Marin and come to work here in Marin? Do you see any additional risk factors there?
Only the individual risks that they take themselves. So if you as a staff person are engaging in risk behavior, gathering indoors, you are increasing your likelihood of bringing COVID-19 into our community. And so that's the primary driver again. But what we are demonstrating is with the school site specific protection plans that even if you enter, and this is our belief from the beginning, is that we needed a universal precautions approach to assume everyone has COVID-19 when the strategies that we have in place make it very unlikely, even if a person is COVID-19 positive on a school campus, that they will transmit it to another person on that campus. Mm-hmm. And then again, there's so much control we have in ourselves. Even if we were having close contact, like I said, the risk is less than 5% that you would, if you had close contact without a mask with getting infected with COVID-19. But we can't forget the basics. Hand washing is one of the most important strategies for preventing the spread of disease. Respiratory etiquette's another important strategy, those face coverings. There's a lot you can do to protect yourself. So that's why.
Mm-hmm. So Lisa, with that, I think we'll be able to say thank you to you again for all the work that you're doing. For everybody on this call, we have planned to have a call like this every on the first Thursday of the month. So the next time we'll have this available is on the 4th of March, same time at 4 o'clock. We'll be able to do an update at that time. Several people have asked Lisa for the potential of actually having a conversation that would be specific to the high school, middle school scenario and how it is you're thinking about the use of stable groupings versus cohorts. And so I will talk with you about trying to set that up. I had a chance to speak with some of our colleagues in independent schools today, and they are very interested themselves as they're looking into the next phase in. So we'll do something to set that up between now and the next session for those working in the middle high school areas to get a sense of what things are going to be looking like. So to all of you, thank you very much for everything you've been doing on behalf of the students and their families in Marin. The data wouldn't be the data it is, except for the fact that you are approaching this exactly as we all are, and that every interaction we have at our school site or anywhere else is with someone who is asymptomatic COVID positive. The fact that the children and students in this community have been able to attend school in person, are continuing to be able to attend school in person, and that we will see more of that in these next weeks is frankly nothing short of a miracle, I would say, or it's unbelievable. It's extraordinary. And you look around at other communities where in San Francisco, the city's suing the school board, and in Alameda and San Mateo and Contra Costa and Sonoma, we don't see students yet having opportunities to be back in school. And so to all of you, you are amazing. We thank you on behalf of the students for everything that you're doing. We promise to keep the data moving towards you, doing everything we can to continue to keep everyone safe. And with that, thank you from the 40,000 students in Marin County for being the amazing educators you are. thank you all very much. Dr. Santora, thank you.